Okay. Good morning to sir.
Good morning.
Shall we start?
Yes, yes, ma'am.
Yes.
Yes, we can start.
Okay, sir. So, this is lecture 7. Uh, so Professor Rao will be the speaker of this lecture. Okay. Over to you, sir.
Yes, thank you. Yeah, namaste to all, and welcome again for another lecture in this Gyan series. And today's lecture number 7 is on mathematical modeling, as you saw in the title and the program for the HIV/AIDS in India and policy formulations. And you already heard a very nice lecture yesterday by Dr. Redhu on mathematical modeling. And today also lecture number 6 by Professor Kumar on the foundations of stochastic process and mathematical modeling. So in continuation of that, today we will have this lecture 7 on realistic mathematical modeling and how do we do realistic policy based outcomes. How do we bring the realistic policy based outcomes based on the mathematical model? So this talk is about that. And in India, during 2006 to 2011, for the third 5-year plan, I was one of the government's committee for building mathematical model. And again, for the fourth round of 5-year planning, also I was one of the member. I was leading the mathematical modeling aspect, collaborating with the public health experts in India. So this talk will be a summary of that, as the designers, Professor Kumar and Dr. Redhu, they put this HIV/AIDS modeling. I thought to explain that part, and again we'll resume after this lecture 7. Lecture 8 will be again back to the stochastic process. Where we left yesterday, I will start in that particular about the Kolmogorov, Chapman Kolmogorov equations. I will start from there in the next lecture. So let me share my slides. So these are all based on the several articles, the summary, various articles we published. But then I will go through in a very elementary way, just to make sure that understand the participants understand the central ideas of the mathematical modeling, which was practically being applied by the government of India, by the health ministry and the National AIDS Control Organization. They implemented the model based outcomes whatever been designed. And in fact, this is the one of the very few examples in the world where mathematical model based policy was implemented by any country in the world. So first report was in 2002, then 2006, 2007, and then 2007 to 2012, that third and fourth 5-year policies. So as you see that, first I will, this particular purpose of the project was to provide HIV/AIDS estimates in the country for the third round and the fourth round. So the summary, this is one of the models, a summarized model. I'm not going into the details. Then you can see the details in the reference I showed. But then I will explain you the necessary information that is enough for you to read the full article. So this is known as this model. In contrast with the stochastic model, in the stochastic model, we saw that yesterday there is a random variable will be there, and there are some states will be there, and state space will be there. But in the mathematical model, especially for the transmission dynamics model, there will not be any random variable here. There will be variables which are usually called compartments, So total individuals in a population are divided into some compartments. They are infected and susceptible. Susceptible is those who are likely to get information, those have some risk of acquiring infection. They are known as susceptible, and then those are infected. And infected could be categorized infected with what kind of disease they have. So in this case, they are HIV and AIDS. Sorry. So HIV and AIDS, there are two categories, and then there are STIs, that is sexual transmitted infections. So this is how the model has been divided. And then they are called compartments. So these compartments, individuals, those who are HIV, they could acquire other infections, and those who are non-HIV, the STI, they acquire HIV, and then after some time they advance to the severe symptoms that's called AIDS, and then after some time, the patients could die or they remain as a infected with AIDS. They remain with AIDS and then continue on the treatment. So if you see that, four compartments explained here, susceptible, yes, G, I is the infected, G for stand for STI here, I for infected with, again with HIV. This is STI, this is HIV, and this is full blown AIDS. So this is susceptible means those who are likely to having a risk of acquiring. So risk of acquiring, I will explain the equation. So here these are four differential equations. In the yesterday's talk also you saw that while we discussing the Poisson process, we saw that there is a differential equation, and we solved the differential equation using a probability generating function. And then that differential equation has terms that those are not purely deterministic. They are having some stochastic nature. That's the distinction. But in this, the differential equation model. Here, all the four that model yesterday we saw, Poisson model. So nature or stochastic nature with random variable component inside that those functions. But here in the right hand side, the susceptible lambda beta. Lambda and beta are the parameters. SGI are the variables. So a mathematical model will have variables and parameters. Parameters are usually determined prior to building the model, and those parameters are used. Any question? Okay. So parameters are used within the model which can explain the dynamics of the model. So here so RISI is the growth rate, a net growth rate in susceptible population, because susceptible population means if you consider the in a smaller population, the change susceptible keep on changing because risk of individuals, either they could change because of certain age they attain, or they are minors to when they become adulthood, or any other reason that the susceptibles number change. Risk of somebody like a cancer. If you're studying the smokers smoking cancer support, then they stop quitting, they quit smoking, that means they are no more susceptible. And as an example, similarly, a person with HIV, stop the risk behavior, so they are no more susceptible. That's what the net growth is susceptible minus those who acquired. Because once from the compartment, those who are acquired, those are susceptible. Once they acquire any of the sexual transmitted infections or HIV, they are knowing their status. So this is in a way similar. The modeling structure is different, but yesterday in the stochastic version, you saw that the states are changing. So similarly, this kind of models, the mathematical models, it is a kind of a similarity is there, but the mathematical structures are different and outcomes are different. Here outcomes are the number of susceptibles, number of infected with STIs, number of infected HIV, number of AIDS. This is number, our main distinction. And then susceptibles are removed. That's why minus symbol. There is a differential equation. Minus this symbol means so these numbers, susceptible numbers, are removed as soon as they acquire infection. They are removed, and the plus 5GI. So the 5GI. Sorry for the there is some haziness in the letters. This is my fault. uh, I just copied the figure from the screenshot I took from the article I published, and then from there I just pasted here. There is some reason for the haziness, but then you can still see the symbol here. 5GI, 5GF is the recovered. Those who are recovered back, so some of the STIs, they are recovered from the sexual transmitted infection. Again, they go back to the susceptible. They are still ready to acquire HIV. So then they are added here back. That's a plus 5GI. Similarly, susceptible in those who are, the sexual transmitted infection, the change dynamics in that is explained by the function, minus again those who are either recovered or died, and those who
The second formula, minus G. That small g, what is that small g?
A G is another function. This G is another function. G has a function of capital G, I, alpha, Ij. These two are the variables. Ig and capital G, capital I are variables. Alpha is a parameter.
Okay, sir.
So you see semicolon here. These two are comma. That means two variables I described. Two variables and one parameter. So that means G is a function. This is G, small g is a function. F is a function. F prime is a function. So three functions and H is a function. Four functions are there. The functional forms we are not discussing here. The functional form, that is the arbitrarily. I mean, this just abstractly I'm describing here. Give you an idea, overview of an idea. Distinction between a stochastic model versus a mathematical model.
Yes, and how difficult it is to solve such differential equations?
It is the difficulty is not. I mean, it is not difficult aspect. What we do is here equilibrium solutions. We consider equilibrium solutions. That means x equal to 0 left hand side, and then we solve them, all the four equations. That is known as in mathematics, that is known as equilibrium solution. Are mutually susceptible for either G or I. He is not having, he or she not having
Small j, small letter.
Yes, susceptible from the I to J means one gender to another gender, because the transmission only determined exactly either the transfer between the states or other things, as explained, certain kind of situations as we explained in the stochastic. There we build only that kind of situation, we build only stochastic models. And the outcome of a stochastic model is probabilities. What we are getting ultimately is a probability. Yesterday, you remember that the model P and T. P and T means probability that there are n number of things at time T. P and T, probability. But here, when you solve this model, we will get the number of susceptibles, number of infected with G, STIs, number of HIV, number of AIDS, numbers. We solve this model. When we need this kind of outcomes, we build mathematical. When we need that kind of outcomes, we build that kind of models. Also, you saw in the case of the infertility situation, there the decision making has to be based. What is the chance that a woman becomes pregnant? We're not asking number of women become pregnant there. That is not the question there. The question was, what is the chance that given treatment, A, B, C, D kind of treatments, what will be the chance that a given woman would be pregnant? See the question there. Now here, what would be the number of HIV within a 5-year period I mentioned there? That was the question they asked. Growth rate of the numbers. We build a mathematical model, and then we can discuss, some other time, the mathematical modeling about basics. But then, given these essentials, you are all good to go to the articles to read what happened exactly in the complete story. So now, what is that? The new modeling approaches for government interventions was, given this model, the government asks questions because the government they have a set of rules, set of things to implement in various states, various union territories in India. They have some certain policies to implement to control the epidemic. Then how those interventions or the policies by the government impact the actuality in the ground. Ground means actuality in the population, how much they are controlling, how much that those policies controlling. That's what they asked. So that's for which the mathematical model is built, and then the the outcomes are provided. And the structure of the model, as you see that here, this is a diagram showing the same thing I copied again from the article here. So the HIV, those are some of them. Some of the compartments in a population are HIV, some are susceptible, some are STI, and the male, female. Their AIDS and the total number of AIDS. And there is question. Parameter and the dotted line indicates the transmitted population. HIV male infect female susceptible. Similar HIV female infect male susceptible, and they die. Each compartment, there's a chance of dying at a rate. And STI, similarly, STI male infect female susceptible, STI female infect male susceptible, and they all progress HIV to AIDS. This is the structure of what I explained here. Because total population, this is built for the national level model done at the national level. And then the summary.
Article will be shared, sir. Sir, please share.
Sorry, yeah, go ahead.
Will you be sharing?
Yes, I can share. In 2006, for next 5 years, what would be the situation? And then you see that here, the government released data, 2009 data. This is what the actual number, and this is the model prediction. See how close we are. In 3 years before, we predicted the number. And this came into the worldwide appreciation that the model we built for the government of India was very successful. And then that actually helped, because worldwide, if some of you can recollect that, they say the HIV will be very high in India. WHO, they all projected so high. They sold their drugs in India, therapies in India. So many, they're scared, But then the actual numbers were not so high. So this is the first time we supported we showed that in reality the numbers will not be so high, and then that helped the government to control the infections successfully. And so that you see the red marks are actual data, and these are the model predictions. They came so close. So this came as in one of the things article I showed there, how that influenced how the mathematical modeling influenced taking the good decisions by the government. This is also available in the various articles I showed in the slide. This is, the purpose here is for the Gyan lecture is not about the article. It is about the utility of mathematical modeling, and then the contrast between the stochastic model and the mathematical model. That distinction now, because the participants need to, what is the other side, when you're eating some food, what is that other food look like? So this is just for that purpose. We are not going complete, but I will be happy some other time, So this is, as I mentioned, this is a government data, actual data by the Health Ministry.
Sir,
yeah, go ahead.
In this 50% target, 75% target is target in terms of?
Correct. Good question. So target in terms of means the government, when they given the reaching their own target, 50% government has a, that they have budget when the, in the March month also you see the government releases a budget, and they allocate money, and they based it on the how much intervention based on the truck drivers intervention, how much on the mothers with pregnant mother, how much intervention with the adults with risk behavior, all these things, they want to focus on them. They have some targets, like the various ways of controlling the spread of the disease. Whereas they have listed about 20 kind of target, and then if they reach 50% of the target, their own target, what would be the number? 75% target, 100% reaching target. You see that higher the target received, the number would be lower. So 2009, if you see there, this number indicates, this is again model-based target, model-based predictions. This number, you see the predicted HIV number, this is about little bit about 2.2 million to 2.5 million cases in India. So we have not reached even 50% of the target there. But then 2011, see that the projected number reached 50% of the target. This is a big achievement. That means the target. And then various, I mean, there's nothing to do with, I want to, so there is a journal, there is a magazine called Connect. Connect is a magazine published by the Indian Institute of Science. They release quarterly. So they also interviewed me, and then how this mathematical model. Since independence came, this is the first mathematical modeling exercise adopted by the government of India since our independence. Then after that, now for COVID also we worked on various things, various other worldwide. So also, I want to. This is what the quotation from this article. So these models, they say that. So first thing, they appreciated the various things, and then they said that government could bring down. This is the quotation from the Connect, the magazine. The government could bring down the number of people living with HIV from 2.4 million to 2.08 million in 2011 because of the interventions. They all, you can see the connector I showed in the beginning, the slide. I can show the slide again.
Excuse me, sir.
Any question?
Sir, when we do this mathematical modeling, we should aim for 100% target and do the modeling, or how do we do?
We can do, that's what we did, 50, 75, 100. That is what they asked at that time. When the ministers, because they are the responsible in the parliament, so they ask what is that they wanted. Our job as a stochastic modeler or mathematical modeler is to provide them what is that, because they are answerable for the public. If they ask
what changes we make in the equation, sir, then 50% target ke liye equations badal hoga.
That's a good question. What is what? Wait a minute. So let me go to the slide. Just a minute. So what is that slide here? Yeah, this is just one model. There are several models are there. I showed a prototype one model. See here, the parameters lambdas and betas. Lambda is what here? Lambda is a parameter. Transmission rate from the S to G, transmission rate from G to I, G to S, and beta is from I to infected HIV to HIV infection from infected to susceptible. Lambda is a transmission from STI to susceptible. So transmission rate, the intervention increases means transmission rates do change. Transmission, how the transmission changes in the ground, on the ground level, that is influenced by the intervention targeted. If the distribution of the the syringes or somebody like in Northeast, this is not a this particular model is not for the injection drug users. So injection drug users, when they ask if they share the injection, as an example, one example I'm showing, if they share the injection, the chance of transmission of one person to another person increases. But if they don't share it, why they have to share if there's shortage of injection? They are using drugs, but then if they don't share, at least you provide them the injections. The same within the US also, I see that some pockets when they cannot control the drug use, what they do is they provide them individual injections. So they keep their infection with themselves. But despite of that, if they don't share, if they don't use their own, they want to share, that means the targeted intervention has not reached. So these all have to be translated into mathematics. So the transmission rates do affect. In a shorter conclusion, that transmission rate, what you asked, is a sensible question, because that's how practically that is affected. Yeah. Then even the current science, the guest editorial, they also written about our work, how that mathematical modeling has influenced the government. So that time I was at Indian Institute of Science, and then this is a guest editorial written by two authors. I have described in the first slide. So that editorial written by them, they also appreciated that in 2018. In the guest editorial, they wrote about how the mathematical models are practically helped. So even the influence in the government, see, there's an influencing Indian government policy through mathematical modeling of epidemic India. These are the worldwide, they covered all over world, the news, because this first time very successful mathematical models were built that assisted the government in controlling the pandemic. Yeah, then this first model that was not having any treatment. Treatments were not available widely. Now the second model, this again, the abstract model, the details can be found. The second model about the therapy, how the treatment intervention through therapy, that means how the HIV individuals under certain treatment, that controls the transmission of the virus to others. Because those individuals who are on treatment, their viral load, virus in the body becomes so low that they don't transmit. Similarly, for COVID also, you remember that the COVID, because the Professor Kumar, they kept HIV/AIDS, because I gave already a talk on COVID modeling for the MDU in other occasion. That's why I think he kept HIV. That's a good idea to expose both kind of models. So here also you see that antiretroviral therapy. Antiretroviral therapies were introduced, and then they asked the question. This is fourth round of planning. How these new treatments affect the government of, Indian public in controlling the epidemic. So then again, you see that the number of infected with X1, X2, X3 are number of infected before developing AIDS, and Y1 are the number of infected who are on the first line therapy and second line therapy. They are technical terms. First line therapy means there are two kinds of therapies are there. The details are unnecessary. First line therapy means all the HIV individuals are given the first line therapy, and some of them don't respond to therapy. For them, the second line therapy is given. Those resistance, like we use we have a cold or cough, we try some medicine and then doesn't work, we apply other medicine. So similarly, that's a government asked out of two. Please.
Sir, my question is number of infected before developing AIDS.
Correct.
So this means that symptoms.
Yes, infected
And
HIV infected, and then later they develop AIDS. Infected means,
can you clear it? Infected,
HIV infected.
difference between infected and developing AIDS.
Correct. Good question. Infected means they are HIV positive. They need not be AIDS.
Right. Thank you, sir.
Thank you. Good question. Yeah. Because some other time, when we have the complete mathematical model discussion, I would love to go through all these things, because this is also essential. The two things I do, my stochastic modeling and mathematical modeling both, but this particular GAN course is important because stochastic models, they were classically been very popular since 1902 by Alfred Lotka. He has shown how the stochastic models are practically utilized on the populations. In 1902, he wrote a book called Length of Life. And then later Marco brought the yesterday in the discussion, and I explained about the Marco got the idea, and then they discussed the Chapman-Kolmogorov idea. They all developed 100 years back. At the same time, the first mathematical model for epidemic also developed in India in 1911, 1912. Kermok McKendrick. They were actually born in India, but they were under the British controlled Indian children. So they were Kermok McKendrick developed SIR model, but they developed for Indian plague. That was then India was under British control, and we were not sure whether we get the independence that time. India they were India was captured by British that time, 1911, 1912. So that time the SIR, same thing, mathematical modeling and infectious diseases, 1910, 1912 they were developing, and the same time stochastic models 10 years before. The ideas were there, but practical utility of them were developed about 100 and 110 years back. So students or participants, this is just a small menu. I'm showing it, just a taste of food, and later you can have a wider discussion on that. But the questions you're asking is very sensible. Now, come back to the therapy. This model helped them to with the change in the numbers. 3 kind of individuals, the with infected before developing AIDS, with AIDS, and then after adjusting first line, these X1, X2, X3 are HIV, AIDS, and then those who are people with first line treatment.
And how this first line treatment is being identified, because in all these equations I see numbers, basically count in the left hand side and count in the right hand side. So how do we formulate these differential equations? Because there could be a possibility that our number of the people have been given the first line treatment, alpha 1 did not respond, and then there could be alpha 2 also who forgot to take the medicine, or similarly we can find the n number of the other parameters which could have affected the formulation of these equations.
Correct. That's a good question. How do we formulate? So the formulation of a differential equation is from the ground reality, as we saw in the stochastic modeling. How this transmission, so that's where this model, when we built the model mathematical, ideally for even for stochastic model, yesterday one of the question raised, I explained that we go to the hospital management and then discuss with them. Similarly here, the public health experts and the mathematicians came together to work. So public health expert, every time, each day we were together and working. Each day, each time we have to present the results. Then the outcomes are not matching. The public health experts won't agree. So that's how the model building based on the back and forth with the discussion with the public health experts. In this case, you see that the growth in the infected before developing AIDS and minus at a rate, what rate? They actually do not remain in the in the HIV. They at what rate they develop AIDS? Those who are not having treatment. Those who are here, these are X2 means the number of infected before developing AIDS, number of with AIDS. X2 is number of with AIDS. At what rate they again change from first line to second line. They develop resistance. So lambda at what rate they develop resistance, and then they don't respond to the therapy, immediately they need to be changed to second line therapy. Resistance, when the resistance means they stop, there's like a resistance word usually you will hear in the malaria example. The mosquitoes are become resistant. That means whatever treatment we provide nearby our house, mosquitoes still keep on coming. That means mosquito become resistant for the treatment. So we have to change the treatment. So at what rate to be changed? Again, the government, the public health experts sitting with them back and forth, and the parameter estimation to be done with them. And then what rate they don't respond.
And sir, why do we have only counts and the numbers? Is there any specific reason of having only the counts? Like say X3 is also a count, X0 is also a count. I mean, we are not observing the change in the parameter itself over the time.
No, count. No, here this is a mathematical. This is a differential equation model. What happened? This is not a count.
So X1, X2, and X3 all are the numbers. It is a count of the people who are either being infected or are likely to be infected in that sense.
Exactly. Yeah, this is the meaning. Meaning is numbers, but in the differential equation, they are not just a multiplication here. I mean, they are multiplied, but then when we solve a differential equation, these variables, we have to use several methods to solve them practically to obtain X1 value in terms of the other things, X3 value in terms of other things. So they become a function. When when we solve the differential equation, these become function, but to demonstrate how a differential equation, how the parameters are applying. So alpha 1 applied on x naught, p1 applied on x3, delta 1 applied on x3. So because here we are not discussing the mathematical model formation and obtaining a steady state solution, I'm not discussing that, but these are not just a simple multiplication there. It is not, I mean, this change is not obtained by the simple multiplication of that.
Okay.
Sir, is there some books with which helps to formulate these type of differential equations?
Sorry, I did not first part. What is that force? Can you please repeat the question?
Sir, how can we formulate this differential equation? Is there any book who help us?
A book, you mean? Yes, I mean there are several books are there. I can list out the book name of the books. On the the fundamental, when I was teaching the differential equation course in India and here when I teach, I follow various Fred Brower, one of the book I follow, and also other book also. I can list out the names there.
Okay, thank you, sir.
Yeah, sure. I will list out once the model is done, I will list out all the books name right away, as I did yesterday. Yeah. So there are variables and parameters are there.
Excuse me, sir.
Yeah.
What is X naught here? What represents X naught?
X naught here, that is not explained here. That is previous from the previous this thing is taken. So those who are individuals who are susceptible there, at what rate they are coming into this picture, the situation they are moving here. They just copy pasted from the article. So the X naught is what those who are in the X3 stands for the number of infected after adjusting. So they are that before adjustment was done, what was that number? Good question. And the article details can be found in the front this one. You see that improvement in survival of people with living HIV/AIDS and recruitment first line, second line therapy in India, mathematical model by myself and the other public health. They're all clinicians and these economists. It came in the Notice of American Mathematical Society, that article, and influencing HIV/AIDS policy in India through mathematical modeling, myself and Philip Maney. And then the current science editorial and the many other articles I will send to Professor Kumar all the articles. And this is how the model, and I'll list out the books right away. And then this is how the projected people living with HIV, first line, second line therapies. You see that here, the projected number. So over the time, the first line therapy will come down because resistance will develop, and second line, third line, and then 50%, 60% survival rate. What different survival rates. This is a snapshot only. I would love to discuss some other occasion on this mathematical modeling for various infectious diseases. In fact, last year I gave several talks during the pandemic as various mathematical modeling. But this stochastic process also, that kind of probability of transmissions are very important. For example, the beta in the mathematical model, the beta is obtained through stochastic process. The beta here, this beta is obtained through stochastic process. Yeah, now let me list out the books. This is a book name by This is for differential disease dynamics, disease and all these various mathematical modeling. And then the purely for differential equations. Book by Simmons. Berkoff. So these two I followed when I was teaching differential equations material. And yesterday's stochastic books mentioned those I followed while teaching that. And Anderson, this is in fact this is a few months by Anderson May. Anderson also, they both were also my mentors when I was starting my research. Anderson also my collaborator. May also I worked with him, and they wrote a classic book on differential equation. I mean the disease infection disease dynamics.
This Anderson and May have talked about modeling in their book, sir.
Sorry? Loud, please. Can you ask loudly a question?
Anderson and May, have they talked about how to do modeling in their book on infectious disease?
Yes.
And recent versions are available, sir. This is showing 1991.
Only one edition. They have not published any edition after that. But there are a lot of articles available. In fact, 2003 or 2002, I published an article in the journal Current Science for the, I don't exactly remember the title, HIV AIDS modeling something. It's not exact title by myself in Current Science. That is written on the basics of modeling, how to build mathematical models. 2000, here you please check yourself, 2002 or 2003. This is started from the scratch and then explained how to build mathematical models.
This modeling, we have to do it manually, or softwares are available, sir?
Sorry, loudly please.
This modeling, we have to do it manually with the equation, or softwares are there to do this?
No, mathematics part you have to do, you have to build. The programming part by the machine. Then you have to write a code for that.
And sir, what about the alternative strategies, like instead of formulating the differential equations, people use the techniques like system dynamics and
that's again, as I mentioned, this code, there are all details that I will be happy to sometime other, because there are millions of ways of, millions is a big number I use, but zillions of ways of building mathematical models, as yesterday Dr. Redu also explained in their talk in the beginning. So the various ways of building mathematical model, which could be partial differential equation. Very recently, on a project from the highway engineering, roads and highways, myself and another engineering professor in India, we both built. He was a civil engineer, and I built a mathematical model for understanding the roads, construction of the roads, and sustainability of the roads in India. For there, we used partial differential equations, PDEs. PDEs for road construction, sustainability of roads.
But sir, my point is that in the other strategies, we need not to form the differential equations of any sort. We simply formulate the rules like in the agent-based modeling. We create the agents.
That's a different, agent-based and data science. They are different. They are not mathematical. Yeah, the structure they are different. You are right. That's what depending on situational dependency. Everywhere we cannot build.
Yes, sir. So what about the accuracy of that stuff, or the accuracy of doing science in that way?
Correct. Everything there is a purpose. Like when we have to compute probabilities, we cannot build a differential equation model. We have to build a stochastic model. Similarly, when we have a graph theory models are needed, network models are needed. When we understand the nodes and edges, we build that kind of models. Depending on the question, what the investigator is asking, type of model changes. Similarly, like as we saw, four type of stochastic models: continuous time, continuous state, continuous time, discrete state, continuous time, continuous state, and so on. So
Mhm.
depending on the data and the situation, we cannot, especially mathematical or stochastic, we cannot say I like, I do. No, it is that what data wants, what question is you are asking, and what type of model you are building.
Right.
I like, I want to do that. That means we are committing some error in the models.
Mhm. So probably, sir, modeling a situation through the mathematical equations might result in the better accuracy instead of using the other strategies, because lot many models came for the COVID patient forecasting, and all of them might be true mathematically. All of them might be true, but then they were not true in the real situation. So yeah, your
Correct.
opinion on this, sir? Yeah.
Yeah, no model is accurate, and no model is because what happens, mathematical model means the approximation.
Right, sir. This is a famous saying of the box that no model is correct, but then some are useful, right?
Somewhat useful. That's what any because in general, all of you, this is important to listen. We say what all the planets are spheres, isn't it?
Mhm.
Planets are spheres, or Earth is a sphere.
Mhm.
But in general, sphere means what? If you hold a sphere is a smooth surface.
Mhm.
But Earth is a smooth surface. The mountains are there, the valleys are there, Pacific Oceans are there. So Earth is a smooth surface?
No.
No. But we say Earth is a sphere is a model for Earth,
Mhm.
like that.
Right.
Practically, mathematical model. The name itself it's a model. It is not exactly be true,
Mhm.
like
Right.
that. Yeah. That doesn't mean that because no model is right, so we can build any model of our choice. That justification is not valid.
Right. Right. Right.
We have to be. That's the reason collaboration is very important. Applied collaborations are very important, and we have to respect the other scientists who have not mathematical background, but they're the because basic science involves maths, physics, chemistry, and biology. Collaborate together like genetic models. Will also in the stochastic model. Similarly, the understand the hospital data. So data plays a very important role, fitting
Mhm.
the data to the model. All these things we have to take care, not just the mathematics part of it.
Right.
Okay. So with this, we stop the lecture here. Lecture 7. This is an idea only, just showing you the small menu as a contrast. Now you can, when we go back to the stochastic process again, next lecture, you see that, you will again connect more. What is that distinction between the mathematical and stochastic model? And then what are the key factors involved in stochastic modeling? So with that, hope you all like the this thing. If you have any more questions, I can hold for a minute, or I can we can stop it depending on Dr. Redu.